Let's talk about the opioid epidemic. We are the trauma troopers. The opioid epidemic continues to take life after life in the United States. Over 50,000 people die each year due to overdose. The only combative treatment for an overdose is a nasal spray called Narcan. Narcan has saved lives. We wanted to learn more about solutions for the country's biggest epidemic. Our main research question was, in patients who present with opioid overdose, has the distribution and availability of Narcan and increased education affected the fatal outcomes of these overdoses within the last 5 years? Based on our research, we came up with 5 clinical recommendations. Educate the patient, educate the community, educate the patient support systems, have easy access to Narcan, and diminish the stigma of using Narcan. Research has shown that when long-term knowledge programs are created and patients have an improved attitude towards using Narcan, there is a reduced opioid-related mortality. Firefighters and paramedics play a huge role in saving lives with Narcan. Including education training on Narcan for appropriate careers could end up saving someone's life. It is important that family members know to call 911 first, and then administer Narcan when help is on the way. Studies show that most opioid overdoses happen at home with enough time for a bystander to intervene and save a life. The University of Texas at Austin started a program that showed the benefit of having Narcan readily available. Each dorm provided Narcan at all times, and students and school employees were provided with education for its use. Within the first 2 years, at least 5 lives had been saved. In conclusion, the increased education for patients, the community, and support systems regarding the signs of an opioid overdose could play a significant role in saving a life. Along with education, the availability of Narcan is extremely important and should continue to be distributed across the country. With increased education and Narcan availability, it is our hope that the rate of fatalities will decrease and this epidemic will be no more.
Created using Powtoon.